But reducing the stigma has to go hand in hand with ensuring that the comprehensive services are there when people ask for help. So, I'm here today to thank you and to ask that you continue to work with us to protect and preserve the valuable support that the Division of Mental Health and its community partners provide for people in need. We need to continue the funding. We cannot cut the funding. We need to increase the funding for people. So I'm here to join with all of you to make our voices heard so that the state of New Jersey understands and knows that Bergen County wants more money, not less. Thank you.
The providers who have organized the event understand the complexity with which the mental health system works. They are the experts, and they are asserting with facts and fear that the system will fail without maintaining the state's investment and involvement. We would be wise to follow their guidance and avoid our community mental health crisis.
And as I've been laying out right now, more and more people are reaching out to get services. More and more people are reaching out in their communities and throughout the state to get the treatment that they need. And that's great. However, as also been talked about this morning, funding is becoming a serious issue, has been a serious issue. And what we're seeing now is shrinking state support and increased demand. And what that does, you can hit it one more time, and there's a cute little graphic. It's putting us all in a really difficult position. How do we treat all those that need services, the growing number of people that are coming out and need services, with limited and decreasing and reducing resources each and every year?
We all share in the ramifications of this nightmare. Nearly 1 out of every 4 adults is diagnosed with mental illness in any given year. When the system fails them, the community as a whole will be forced to pick up the pieces.
You shouldn't wait till the water's up to your neck to realize the flood is here. You should do something about the flood before it gets there. Next slide, please. That's $7, check this out, and I'm sure you could do the math as well. So that's $7.50 per year available for everybody else in the state who's not on Medicaid. You wouldn't fund anything that way. I mean, in fact, if you were to say to the citizens, let's all chip in $7.50 a year for the people in your town who need mental health care, most of them would think you're buying lunch. $7.50 a year to do this wide range of services, as you do in New Jersey. The entire array of services are supposed to be funded for $7.50 per year per person in the state of Michigan who's not on Medicaid. Now, next slide. This safety net's at risk. The holes in the safety net are big. And as we point out here, every citizen assumes that safety net is there for themselves and their loved ones. Everybody does. Everyone says, yes, my community mental health center is here and I can rely on them. If my life starts to fall apart, if depression creeps up on me, if I become more anxious, suicidal, psychotic, I know I can go there or my loved one can. And it turns out, if you're not on Medicaid in Michigan, your chances are slimmer than they've ever been at getting that kind of care. This is rationing care. Let's just be clear about it. Healthcare is rationed in America, but this is severe rationing. There's not much left on the table and we're trying to spread it among the kids who are going to eat. It shouldn't be that way. So if someone on Medicare or without insurance, or with insurance, comes to your mental health center and says, I need case management, sports coordination, residential care, peer services, drop-in, you name it. They're not going to get it, not with their commercial coverage. So your CMH then has to struggle, do I serve this person who does have insurance? But parity laws, I could do a whole lecture on parity laws. The parity laws are not enforced, and so there's a gap in commercial insurance that none of us had planned on that is drawing down the dollars that your local CMH is going to have and that your local service provider network will be without. From 2006 till 2013, it grew every year. In 1 year, because of that cut, it dropped by 10,000 clients. 10,000 clients overnight lost their ability to get into the mental health services because of the kind of cut you're looking at in New Jersey. A different mechanics. They took the general fund out totally to expand Medicaid. In your case, you're taking it out to pay greater rates in Medicaid. Same dynamic, though. That's eye-popping. So the services eliminated are all the services you would guess, all of our core services. Non-emergency psychiatry. Now, if you work in our field, and you do, or you have loved ones who need psychiatric care, it's always an emergency. But a CMH then has to make a call. Will that psychiatry services be essential to make the person, you know the old term, not of imminent risk to self or others, right? So if their life is just falling apart, we can't serve you. If your marriage is falling apart, your job's falling apart, your parenting ability is falling apart, your ability to do well in school, you're not going to get into the CMH system unless you have a Medicaid card. That's the kind of gap you're facing in New Jersey. So the advocacy is starting to close the gap. The first line is key. It's, you know, a day late and a dollar short. Communities are now recognizing the hole in the safety net. What it took, and this is the sadness of it, it took some very high-profile suicides in local papers throughout the state of people with insurance who couldn't get in. That's what it takes. Now, we shouldn't live in a world where we have to wait till one of our family members dies before we realize there's a problem. Thank God you're having this breakfast now. This drumbeat has to continue. Our issue, unlike most issues, has bipartisan support. The farthest right and the farthest left all agree, because they have a loved one or themselves in need of care, that this system needs support. From Michigan, I bring you the warning that you know yourselves. This is advocacy at its best. It's why people across the spectrum here have to get behind this issue. The community does get it. And we do need to make sure that heat and light are both felt in the halls of our House and Senate. Thanks very much.
There is money coming into the system from the federal government. Meanwhile, the mental health line item in the state's budget is essentially disappearing.
Good people, but people that suffer from a severe and persistent mental illness. Mental illnesses like schizophrenia, mental illnesses like bipolar disorder, mental illnesses like major depression with psychotic features. Good people with serious mental illnesses. Good people that if they don't get the services that they need, experience bad outcomes. Bad things happen to them. And things like death. Individuals with severe and persistent mental illness, according to the Centers for Disease Control, die 25 to 35 years sooner than the rest of us. So the community mental health system is very important. It provides critical services. It provides life-saving and life-changing services. As I like to say, we are not baking cupcakes. We are not making baskets. We're providing critical services that must be financed to make a difference in people's lives. Now, when I say 1 in 17, that affects everyone in this room. That's your brother, that's your sister, your mother, your uncle, my Aunt Shirley, your friend. It is not an abstract situation. Everyone here has a loved one and/or a friend who suffers from a severe and persistent mental illness.
So to begin with, we will lose collectively $6.1 million among the four of us. That translates, which is really the important part of this, well, into 60 employees. So not only will clients, and I'll talk about that in a moment, will lose services because we'll lose 60 employees. And the majority of that will be psychiatrists because the rates just don't work. It'll also be clinicians, of course, support staff, other people who do lots of work behind the scenes at all of our organizations. 5,500 current clients. So I'm talking about when we look at our numbers of who we serve, which is 20 to 30,000 among us a year, 5,500 of those will lose services almost immediately on July 1st, 2017. And most of those will be those who receive medication management because the rates don't work. So individuals, children who are so anxious they can't get to school, who come to us for medication and therapy, won't get that help. We keep people stable and in their communities and out of the hospital. Mothers who have taken their children away from them because they have postpartum depression, or there's some bipolar disorder, something else going on. We keep them stable with the medication and get them back to take care of their children. Adults, men, women who have depression, can't get out of bed in the morning, they're on their medication, they get back to work, they fend for their families, they support their families and their children, and provide, jobs at the community, and they're giving back. That's what will happen July 1st, 2017. In addition to the 5,500, another 3,500 every year would lose services because we take new patients and individuals and clients every day. Our phones ring off the hook. The phones don't stop ringing. What's going to happen July 1st? It's going to be a crisis. So 3,500 people on an annual basis won't be able to come into the system because of the cuts in the funding. So the burden is on, of course, those individuals who will not get treatment. And then the burden extends to emergency rooms and the hospitals and the police and the schools who refer to us and communities and families. So this is a major crisis. I've been in this job 30 years, and it's the worst funding crisis I've ever seen. It's not about us. It's about the thousands, and in the state of New Jersey, tens of thousands who will not get care. Thank you.
As Chairwoman Huddle knows, this is not only a Bergen County issue, it's a statewide issue.
What this is going to mean is going to be tragic to our community. The freeholders cannot pick up the slack. What we need is the ability of the state to keep contract dollars in our budgets so that we continue to be basically the safety net for our consumers. I've been here 35 years. This is the worst situation that I have seen for funding in our state.
At CPC Behavioral Health Care, we see approximately 8,000 children and adults over the course of the year. This number has steadily increased over the last few years, and we only expect to further increase. But Monmouth County and our neighboring Ocean County have been especially hit by the heroin epidemic, and this is not a time for us to lose, to look to lose access to treatment, but to provide more care to our community. So,
But down in Ocean County, where we're serving about 18,000 people a year, we're talking about 6,000 that we're no longer be able to serve. 360 staff members at Ocean Mental Health, and we're probably going to have to lose probably close to 50 of them. And you're right, this is the worst time for this to happen because those people need the services down there, and we're no longer be able to provide that. Thank you, Kim. 195 people down in Ocean County have died this year because of the heroin epidemic. This is not the right time for us to be able to do this.
In July and August, our emergency department literally had an average of 25 psychiatric patients in it every hour of every day for most of July and August. We have 319 psychiatric beds. They were filled to capacity in July and August, and we're filled over 95% on a daily basis. So where will people go? We had people sitting in emergency departments in the chair because there were no beds, there were no cots. They were sitting in chairs for days. People at other emergency departments who had involuntary patients who needed to come to our facility were there for 8 and 10 and 12 days. These are human beings. These are people's children. These are people's parents, siblings, co-workers. This can only get worse. 319 beds, we work to move people back to the community. What is mental health based on? It's based on a principle of the least restrictive level of care. We want people to live in the community. We want to give them the lives that we all aspire to. What we have are people boarding in the hospital because they have no place to go. If we have more people boarding, we'll have fewer acute beds available to admit people because we're not getting them back into a community that is woefully underfunded for mental health services. So, in fact, we've been underfunded all along. This only makes it worse. I've got people living in my hospital for 3 and 4 years who could be out in the community, but there's no place for them to be. How are we going to add more people to that? How are we going to board them? Where do I put them? It comes down to that. We need to increase funding, not maintain. We need to dramatically increase funding for the community level of care, for housing, for community supports, for outpatient treatment. Without that, this is only going to become basically a catastrophe. That's what I can say.
New Jersey Hospital Association, I believe yesterday, released a report that the emergency rooms are increasing from 14 to 15, 2014 to 2015, and that 50% of that increase are people with mental health diagnoses. 50% of the increase. And we're standing here defending our current system. When our current system falls apart because we don't have a safety net, I can only imagine the increase in the emergency room visits, the increase in jails. People without treatment, unfortunately, do get in trouble, and they do run to the emergency room. Read the Hospital Association report. It's absolutely incredible. We need more funding, not a reduction in funding. So I say contact your local legislator, because he or she is the one that's going to make the difference in Trenton. But vote, 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 and let your voice be heard.
So for law enforcement officers to figure it out and where to bring people is complicated, just like family members, and they're frustrated. So when a system doesn't work and frustration becomes with our law enforcement officers, or we're dealing with people in the mental illness, or probably our first contact are law enforcement, and we're telling them to bring them to services that they bring them to these services and they aren't working, they rely back to the old days. And where's the old days? The county jail. County jail can't say no at this time, right? The door's always open. Mental health obviously is a big issue throughout the state of New Jersey and nationally. Because like I said, if it's not working, law enforcement, the first contact, if it's not working for those resources, the jail is going to be the answer. And as you hear from the cuts that are coming, our main concern is those cuts are going to affect the training as well. There aren't going to be mental health into the class. They won't have the resources and the time to provide that 40-hour class for that subject to sit in the class, to listen, to understand what law enforcement's frustrations are, and to realize that we're dealing with the same frustrations back and forth, and we're dealing and trying to help the same person, but we're not able to talk. So again, we're separating ourselves into, we like to say, different silos again, where we brought those silos together and we're talking. Now they're going to start to separate again. And unfortunately, I believe we're going to end up going 3 steps back instead of 2 steps forward. Just this last 2 classes that Bergen has taught have been 40 law enforcement officers, 21 mental health workers. 2017, with the backing of your Bergen County prosecutor, he's sponsored the CIT program to hold it 4 times a year, which means in 2017, you're looking at over 100 officers qualified in CIT, and at least 50 mental health workers. So we understand working relationships. So he made that commitment. Our fear is the cuts. You've heard everybody talk about it. Again, those cuts are going to provide less employees, less opportunity for interaction. There isn't going to be those monthly meetings on what's working, what's not working.
Obviously, Ed just highlighted the fact that it's pretty obvious that we're going to see more people in the Bergen County Jail if all this goes through. On average, a person with a similar crime spends 3 times longer in jail than a person who doesn't have a mental illness, because what happens is they meet with their lawyer, and their lawyer says, something's going on here, I don't know what it is. They have to find someone to do an evaluation. If you want to get a full psychiatric evaluation from Ann Klein today, you could be waiting 6 months to get that evaluation. So the problem with I'm particularly concerned about the medication piece in all this, because that's the cornerstone of acute stabilization. The idea that that might not be available for our inmates coming out it's a catastrophe. It's a catastrophe.
Mental illness is terrifying. So I ask, where would our money be better spent? In educating about disease and treating it quickly, or in continually funding lifelong housing or worse, jail for those who don't get help in time. No family wants to see the promise of a child disappear into illness. Nothing is more terrible than hearing a doctor say, "You may not get your loved one back from psychosis." Community mental health is everybody's responsibility. Take your time, do the homework, and be the heroes that families need. All of you coming here today was so important. And as a person with lived experience, a mother, a sister, a daughter, and a friend of people with mental illness, I thank you for listening. Today gives us real hope.
So when you look at not looking at the reimbursement rate, but look at the cost, you have police involvement and you have hospitalization versus, wouldn't it be nice if he could just call the clinic, get an appointment, get his methadone? All of that was unnecessary. So when you look at the whole system, you really need to look at the cost of the services because hospitalization is being encouraged. And I think, Tom pointed that out before. And it's not cost effective at all. It's who pays for it. So is it the state? Is it the county? Is it the local? Is it the insurance? It's all of our responsibility, I think. And it behooves us all to address these issues and prevent them from escalating. The thing that gets me is that the taxpayer, the financial solution is also the same solution for the well-being of our patients, that they get treated in the community and prevent hospitalization. Thank you.
I asked to go there for a reason. I needed help. I needed it. But that's it. I probably am in denial still that this is not just because of a breakup I had 3 years ago. This is something that was underlying all along from birth in my family, in my blood. And it chose to manifest in the way it did at the time it did. And now I have to be responsible enough to take care of it. But I can't do it alone. I need legislators. I need funds. And I can walk onto Montclair's campus now and see the stigma-free signs everywhere. I can tell you, though, that everybody on that campus that I'm close with was stigma-free long before you put those signs there. It's about money. It's about the actual resources. Where are my friends and students going to go when they graduate and they don't have insurance and they get to 26 or whatever's going to happen with this circus election? I don't know. They need help. They need help. I need help. Please continue to look around at the signs in this room, and we are all different people of different shades and sizes, but you might not see everything underneath. I don't look like I have anxiety. I don't look like I have depression. Try to talk to somebody that you might have looked at a little bit longer today, or if you found them on the street, you wouldn't necessarily talk to. Have a conversation, have a word, ask how they're doing today, at the least.
These people value peace and conquer crisis. The mental health community does not want to stir up hysteria, but it would be irresponsible to not inform the clients that their services are in jeopardy. The people in this room represent a small portion of those who will be negatively impacted by this miscalculated funding decision. These people are working to warn our state officials that we cannot afford to destabilize this system. It will be without doubt lead to our community mental health crisis.